Hi, I'm Dave Esposito. I'm a surgeon at the Milford Vascular Institute. I wanted to talk a little bit about some of the treatments for peripheral arterial disease, or PAD. PAD occurs when you have atherosclerotic buildup of plaque in the arteries in the legs. And that can happen slowly over time, but eventually those blockages get to the point where they're limiting the blood flow and the oxygen supply to the legs. And typically patients will start to experience pain in their legs. It usually starts with ambulation. People will notice that they get cramping pain in their calves or in their thighs. That happens when they walk a certain distance. And as time goes on, that distance gets less and less. The pain goes away with rest, but they realize that eventually they're having trouble walking any significant distance at all. And it's at that point where a vascular surgeon is usually involved. And the treatments for peripheral arterial disease are usually threefold. The first are what we would call conservative medical therapy. Involves two prongs. One is pharmacologic support, and that usually comes with antiplatelet drugs such as aspirin, or a drug called Plavix, which is kind of like what I call super aspirin. These drugs thin your blood and make the platelets in your blood less sticky and allow the blood to get through the blockage a little bit easier. The second very important thing is exercise therapy. It's very important for people with PAD to exercise regularly. And when I say exercise, I'm talking about just walking for 20 minutes continuously, at least 3 to 4 times per week. This can be done on the patient's own, or it can be done under supervised therapy under a physical therapist or your vascular surgeon. Those things alone for early disease can often halt the progression and increase patients' walking distance. And we always start with these non-invasive options. The second option would be a minimally invasive approach. So as the symptoms get worse and people fail conservative therapy, we can treat them in an endovascular fashion. Endovascular means from inside the blood vessel. So what we can do is go into the artery with a needle and using balloons and stents open up the blockages. Just like we can do in the heart, we can do that in the leg. The balloons blow up the plaque and open up the passageway, and the stents are metal tubes, and this is a stent. They're metal tubes that stay in the artery forever and hold the artery open. So all the plaque gets pushed against the side, and this stent holds open the blood vessel for blood to flow through. And that's a minimally invasive way to open up blockages. Sometimes either that doesn't work, or patients have failed that therapy, and then we can go to the third option, which is surgical revascularization, commonly called bypass, where we take a new blood vessel and bypass the blockage. Sometimes we can use artificial blood vessels. So this is just a piece of plastic, a plastic blood vessel that we can sew in around the blockage, so the blood goes around the blockage and goes down to the foot. Sometimes we can use your own blood vessels. We can take veins out of the leg and turn them into arteries and sew them around the blockages. So there are a lot of options for the treatment of PAD. Again, starting with non-invasive medical options, advancing all the way to surgical options. So it's important that if you have PAD, to be under the care of a vascular surgeon who has expertise in all three of these different disciplines. So we have that here at Milford Vascular Institute. If you ever have any questions or problems, feel free to contact us at any time. Hope this helped, and have a great day.